Welcome, everyone. I'm so glad you're here. This is our first health advisory webinar on securing digital health, moving beyond compliance into strategic cyber resilience, or as our speakers today refer to as sustainable risk management. I'm your host today, Jessica Davis, Director of Marketing and Communications for First Health Advisory. I am joined today by someone you'll all recognize, our EVP of Governance, Risk, and Compliance, David Finn, and our favorite straight shooter, EVP of Enterprise Security and Technology, Rick LeMay. You're in for an informative, engaging session today on reframing how risk assessments can be leveraged under the current threat landscape and policy changes. Assessments have been historically viewed as HIPAA-mandated requirement to check the box on compliance, but effective assessments actually equip entities with the visibility and the intel needed to make actionable risk reduction of both third-party and enterprise risk, and improving understanding and cyber resiliency across the enterprise. We are hoping very much for audience participation today, so be sure to utilize the chat box for all of your burning questions, and we'll add them to the conversation or connect with you after the event to get you the insights you need. And with that, I'll hand things over to our capable leaders to kick things off. David?
Thank you, and I will get things kicked off because Rick is my favorite straight shooter, so I'm going to let him be the smart one today. Cybersecurity, I don't need to tell anyone on this call, probably is not a list of boxes you check off. But before any organization can improve its cybersecurity posture, or more importantly, its cyber resiliency, it has to understand the security threats and vulnerabilities, but also the impact of these threats and vulnerabilities on the people, including your patient, processes, and technology that will be put at risk. Conducting a risk assessment enables the organization to define and understand what the assessment should include. The assessments point to other areas that need to be looked at, but they tell you what will be expected to get to an acceptable level of risk, as well as legal and regulatory requirements. You will never be able to get to where you want to be if you don't know what you have and where you are. Healthcare entities often consider risk assessments as a check-the-box list to meet HIPAA compliance. Compliance is not security. Unfortunately, in 2024 and beyond, you're going to have both compliance and security. Now, I believe that when done correctly, assessments equip entities with the visibility and intel needed to move beyond regulatory compliance into actionable risk reduction of third-party and enterprise risk. And those responsible for IT and security, and that's most of you, and by virtue of digital health, the healthcare organizations they serve, we face ever-changing challenges: governance, operations, staffing issues, budget issues, and the list goes on. Now, I'm going to go back in time. When I first became a CIO, and that was pre-HIPAA rule effective dates, I was actually coming from the privacy and security officer role. And the first thing I did was request a bunch of audits and assessments. The new CIO, you know, a little bit of CYA. But I wanted to see where we were and what I needed to do. And my CEO and CFO approved the span. They kept asking why I wanted to do all this stuff. And my answer was, I can't get to where I'm going if I don't know where I am. And back then, there was no HIPAA, no NIST CSF, there was no HICCUP. We just looked at everything and figured out what needed to be done and in what order. So Rick, I'm going to turn to you. I came at it from the CIO perspective, but how have you seen assessments change over time? What do you get asked now that you didn't before? And is it a different set of people who are looking at these assessments? And how do they proceed now? Because used to be the first question after the assessment is, what do I do?
Right. Yeah, all good, valid points, David. A great segue. So I've been doing risk assessments for quite some time right now. I've been on both sides of the table. I've received them, but I've also been working on them and doing it. And you're absolutely correct. There has been a change in focus from an organizational perspective, but also from a regulatory perspective, right? It's not just to do a risk assessment, okay? It's not just check the box anymore. It is, what do I do with it? How do I maintain and sustain my program. And you can see that from a regulatory perspective. If you look at the, HICP, cyber practice number 10 talks about governance, talks about how do you manage and assess and identify risk. The cyber performance goals also come out and is talking about, doesn't necessarily pinpoint governance, how do you maintain that? But in order to be effective in the essential and enhanced practices, you have to have some shape, form of controlling it and guiding it to get to your end state. And then, of course, the big news that came out in February was NIST 2.0. NIST 2.0 totally changed everything on its head. It added a whole new function called govern, which has 5 categories and 30 subcategories that range anywhere from, how does the organization see risk and how do you manage that risk, to who has the authority and the responsibilities? Do we have the appropriate policies and processes to guide us? Not only just to say that we have a policy in place because it's mandated, but what are those supporting processes required to maintain that visibility and addressing risk throughout? And of course, oversight. Who's in charge? Who has oversight of that? And of course, everything that's been near and dear to, especially in the healthcare industry and over the last 18 to 24 months, is that supply chain, right? Because you can be impacted by your third and fourth party vendors that are out there. So Dave, to get back to you, so who is focusing on cybersecurity? It was a niche. It was IT, the CIO, the CISO, the CTO, to where it's expanded out to the C-suite. The CEO is very interested in cybersecurity. The CFO, because now we're seeing, the cybersecurity insurance providers are mandating certain controls, which impacts the finance part of the business. So the CFO is extremely, extremely important. And then any other boards that the C-suite has to report to, they are also very interested because it can cripple organizations. So, yeah, go ahead, David. No, go ahead, David, please.
Oh, I was just going to say, you've kind of shown us where we came from and who's interested, which is a very good sign. It's always good when CEOs and the guys with the money want to hear about cybersecurity and the risks. But now we're also looking at, I was talking about we didn't have standards to assess against, but now we're going to have non-addressable things you're going to have to do. It looks like the new budget for 2025, it looks like when you look at the conversations on the Hill that there's going to be mandated standards and requirements. Not ideal, but if this is what it takes to get people to do something. But how will these regulations, the HICP and the CPGs, be able to better support providers now and in the future? And how will it change what you're doing with an assessment when you go in to look at an organization?
Yeah, so I'm gonna answer your second part of your question first. So how do we go in and what's our new approach? And it's not really a new approach, it's a modified approach on when we go in and assess, right? I'm a big believer in, you have to have an upfront assessment, kind of what David, which you were referring to, about finding out who we are. How do we see ourselves, right? And then we need time to address those gaps, vulnerabilities that we identify, and build that program that can help you sustain and maintain your entire enterprise risk throughout, for a period of time. And then on the back end, another one, so we can compare. I call them the bookends, right? The front end, where are we at? The other bookend is, look at what we've done up to this point. How do we maintain that into the future? Now, as it relates to, the assessments now can't rely on one framework. The assessments must be mixed, especially when we're talking about CPGs that are potentially going to become a regulatory requirement here in the near future, and maybe some financial incentives on the back end. So if you're a NIST shop, okay, you still have to address the CPGs. All right. You still have to address the 405D HICP 10 practices, depending on, what level you are, small, medium, and large. So when we look at a program, we're looking at it from multiple lenses because they're really all interrelated to some point. But you have to be able to speak out and be able to report on each one of those, because there are going to be some different regulatory requirements and some different requirements that the industry is going to want to see. And one thing we always want to avoid is that assessment fatigue. Assessment fatigue can really, really bring an organization down, right? So the assessment, looking at it through multiple lenses, right? But more importantly, how do we maintain that program through a governance framework, through policies? Policies, not just to have policies, but policies are going to help you get to where you need to go, and then building those supporting processes and procedures, right? So you want to build it so you can sustain it for the long period.
Thanks, Rick. I appreciate that. And 2023, I think, was a record year for healthcare breaches and attacks. But 2024 is making 2023 look like a walk in the park. When you look at Change and Ascension, I actually was in London last week when the NHS was attacked, and the public became aware of it when there were massive blood drives because the attackers had taken out the control and monitoring features around the banked blood. So they couldn't use any of the blood that they had stored across these organizations. And so it was a huge blood drive. So it's real impact and kinetic impact we're seeing with these break-ins now. But understanding and managing risks in the healthcare setting is critical to keeping patients safe and maintaining operations. The system is your operation now. So how do we begin to shift into a more proactive and resilient mindset, given the landscape we live in, from assessing risk to effectively managing risks across the setting and into the clinical environment? How do you look beyond the IT and security issues?
Yeah, great question. We have to expand what we consider an enterprise cybersecurity program, right? Up until this point, it was kind of defined by it's the CIO, it's the CISO, it's the CTO's responsibility, all right? We have to expand that to exactly what it says, enterprise, end to end. We have to talk about the IOMT, which plays a significant role. We have to be able to build that into our overall enterprise program. We have to also look at our third and fourth parties. I gave a webinar a couple of weeks ago with Cincinnati, and we talked about third and fourth parties, the impact that they have, because in most cases, for a third party assessment, we do the assessment and then we forget about it. All right. There's more that you have to do that. And then you have to take everything that now that it's expanded enterprise program, you have to take it in, you have to build that resiliency. Resiliency is key, right? Being able to knowing their capabilities and limitations, incorporating them into your resiliency program, identifying what is critical for an organization. So it can't just be isolated to IT, and it's not an IT problem. It is an organizational problem that in order for it to be solved, the entire organization has to play a part in it.
I'm a governance guy. That's what
You
I've
are.
done. I've built governance for
Yep.
IT, for security, and for data across many organizations. And I think I'm going to ask you a question, Rick, but I think we have a slide that might be a good jumping off point.
Yeah.
But the idea is I think everyone understands that governance and leadership buy-in is critical to making this shift towards digital health and cyber resiliency. But how and why do we include cyber and governance policies into risk assessments? And how does governance really lead to a better risk management program and processes?
Yeah. So governance is the blueprint of an effective program. The governance tells you who's responsible, what they're responsible for, what they need to do to be successful. How are we going to check to ensure we're meeting the goals or objectives based on the policy or whatever the guidance is or the vision of the organization, right? Your governance is what brings your entire program together. That's why there's been such emphasis on it in multiple frameworks. 405D HICP has it, like I've mentioned earlier. NIST 2.0, whole governance piece, right? And then going back to the CPGs, you can't do the CPGs without some type of governance over the topic. Something needs to manage and control the program for duration, right? You can do these little things here and there, but you need something to sustain it, right? How do we sustain our enterprise risk program? Governance helps us sustain that. Build, sustain, and maintain.
And the governance we're looking at, I know a lot of people stand up a committee or two and call it governance, and they meet quarterly and talk about what the kids did over summer vacation and maybe look at an assessment. But how do you get those engaged? This new governance isn't going to be that, is it? Can you describe some of the things you look at when you're talking about an organization's governance?
Sure. So one of the things that one of the things I look at when we look at governance is like, first and foremost, do you have, the reasonably expected committees in place? That's number one. Okay. But that's something a lot of organizations have. But when we take it to the next level is, what exactly is that committee doing for you? How effective is that committee? What are the inputs and the outputs of that committee? What has to be brought into that committee? What is the purpose of that committee? And what is the output? What is that committee going to inform some other governance process? Okay, so we look at the governance. Then we start looking about accountability and responsibility. Who's accountable? Who has the ultimate authority to make a decision as it relates to risk? And I'm not just talking about cybersecurity risk. I'm talking about risk across the organization, because physical risk can influence cybersecurity risk. Cybersecurity risk definitely can influence physical risk. So financial risk, all the different risk categories out there, right? Who is the ultimate responsible for? What is that responsibility? And is it communicated? Does everybody know what's going on? Which is another thing. And how do we ensure that everybody knows what's going on? First and foremost, policies, right? You got to have your regulatory policies. We all understand that. But you also have to have those other policies that can help you govern your organization. And then you need those processes. We dig deep into those processes, right? You can have a process. Not only that you have a process, but what is that process doing for you? It's not check the box anymore. It's how is that process, that policy, that committee helping you govern the organization? So it's not check the box anymore. So we go a little bit deeper and dive into that to see the inner workings. So once again, sustain an enterprise risk program, right? In order to sustain, you got to find out what's working well and what's not. And we also look at KPIs, key performance indicators, which is very significant to identify where we're at, how well we're doing, where we can, make improvements or help make an informed decision. So we go a little bit deeper into what's in that thing.
And it isn't going to be that traditional how many password login attempts were made on accounts. It's really going to be operational KPIs going forward and how you can recover if you're down. You and I have certainly had this discussion, but I'm gonna ask you a question about it so everyone gets the value of your wisdom here. And that is the assessment doesn't matter. I mean, doing an assessment is a wonderful thing, but it doesn't move the needle. It's what you do, what the organization does with the assessment afterwards. So how can security and IT leaders work to shape policy and get budget and help make this lead to reasonable decisions and kind of get a seat at the table for support and drive the message after they've got one of these assessments that can help lead them to that support and that spend and all those good things that the IT and security people want, but the mean CFO doesn't want to spend money on.
Right. So bottom line, you got to tie it back to the business. Well, how is it important to the business? David, you and I have had multiple conversations on that. The assessment is one thing. It's our starting point. It's to figure out who we are, what we do, where we're at, right? Now we identify those vulnerabilities, those gaps, and then we have to figure out how are we going to address that. You have to tie everything back to the business case. So when we talk about resilience, we're talking about, what is important to the business and what are those solutions, systems, process that support the importance, supports those key business functions, right? And that's how we have to tie it back. And in some cases, when you're talking to the CFO, you're using a little bit different language than when you're talking to the COO or even talking to the CEO, right? But you have to tie it back to how it impacts the business is the key thing. Honestly, most senior executive leaders don't really care about how many, blocks the firewall prevented, how many, malware or whatever into it. They care about where is it impacting my business? Is it slowing down my team's ability to do their day-to-day function because of bandwidth, because of multiple things? Well, then maybe that's something that we need to look at, right? So we have to tie everything back to the business. Business case is key to that.
Yeah, I have one kind of closing comment, and then I'll let you wrap up, Rick.
Sure.
But one of the things I've learned is, and we're all, if you're in the provider space, you're looking for solutions. But I kind of eschew that word because in security, the solution for your organization is not going to be the same as anyone else's solution. If you're selling a product, I've done that. You have a solution. A DLP, you know what it does, you know what it is going to find. And if you need to do that thing or find those, you go buy a product. But consulting, particularly around something as ambiguous as cybersecurity and resiliency in a healthcare setting. So how do we create an assessment that actually addresses a solution that's going to work for that organization? You don't want a canned assessment.
No, you don't. You don't. You definitely don't want a canned assessment. And there are a lot of canned assessments out there, right? There's a lot of self-assessments that you can do, right? But once again, that's sort of a bias that, assessment of yourself because you kind of know some things. You have to establish you have to work with some type of framework. What are your goals? What are those standards you're trying to achieve? Whether it's NIST, whether it's high trust, whatever it's, HIC 405D, HICP. It's really up to you as an organization. What's best for you as an organization? Then we have to assess against that. But you also have to look at what your resources and what your capabilities are as part of the assessment, right? Just because you don't have it, let's say you don't have a DLP solution, doesn't mean you have a high level of risk. There are other things that you can be doing or that you are doing that can help mitigate or reduce that risk. Full disk encryption, removable media restriction. You might have some email DLP. You might have, you can't store anything local, whether it's a full disk encryption on the workstation or not, doesn't matter. You have controls in place. So you have to look at from your lens as an organization. But in closing, it's really important that we all understand that enterprise cybersecurity risk, the term enterprise is actually starting to mean what it says in the Webster Dictionary. Enterprise is end-to-end, everything. And that's we as an industry have to go to. It's not just IT. It's IT. It's security. It's fun. It's risk across a business spectrum that we as an industry have to start taking into consideration as we move forward and address all these new threats that are constantly out there, hitting us on a day-to-day basis.
Absolutely. Jessica, I'm going to hand it back to you.
We're so glad that you were here today. If you would like to just spend time with Rick or David to discuss this further, please reach out to us and we'd be happy to connect. Big thank you to David and Rick for their time and insights today. And be sure to stay connected with us on LinkedIn to stay up to date on our current news, current policy and cyber changes. And we hope you'll join us later this summer as we talk more about cyber resilient digital health. Have a great rest of your day and thank you all.